I'm one of the partners at Sacramento Eye Consultants, and so we're grateful that you could join us tonight. This is a great opportunity that you have to be able to learn a little bit more about cataract surgery, what's involved with it, and some of the choices that are coming your way. So we'll just get into it. All right, let me just get to my next slide there, maybe. There we go. So this is our practice. Actually, this picture is a little bit old already. We have a new doctor that just joined us, and I think next week we're doing our photo shoot. So in a month, we'll have hopefully a new picture that'll have all the doctors, at least until October when we have our next new doctor that starts. So we are growing very quickly as Sacramento grows and as people need more and more cataract surgery and more eye care. We're trying to do our best to keep up by hiring more people and expanding our locations and all that kind of stuff. So it's exciting from that standpoint to be part of it. But our job and our goal is to try and provide the best care for you guys and bring the best options to you. So the practice was originally founded in 1988. We own the practice, so that's not, so there's some practices that might be owned by a bigger conglomerate, and we own the practice, and we try and tailor it the best that we can to make it so that it's as good of an experience as we possibly can make for you guys. So we have 3 locations: Sacramento, Lincoln, and Folsom. And then we are all fellowship trained. So whereas some other practices might have comprehensive ophthalmologists, those are doctors that have just done 3 years of comprehensive training. All of us did at least an extra year or 2 of extra fellowship training to get a little bit more specialized. 3 of us that are currently in our practice are glaucoma specialists. That means we did an extra year of glaucoma training. And we all still do cataract surgery, but we kind of specialize a little extra in glaucoma. So that's Dr. Liu, myself, and then Dr. Snyder are the 3 doctors that do that. And then the 3 doctors in the middle of this picture, so Dr. Sierra, Dr. Lee, and Dr. Wu, they all specialize in cornea surgery, so cornea transplants and that sort of thing, as well as also cataract surgery. So that is the group. So why should you be here? Hopefully you're not wondering that since you are here, but these are things that are, it's an opportunity for you to learn about cataract surgery. So it's a once in a lifetime opportunity to have cataract surgery. Some patients are nervous about it. Some people are very excited because they finally get to have different vision. But it's an important decision to make because it's with you for the rest of your life. And so obviously we use our eyes all the time. So any decision we make is going to, anytime we're awake, we're using our eyes. So it's an important decision. So obviously a lot more important than buying a car or a house or any of those things because again, you're using it all the time and it's one of your senses. Yeah, this is kind of what I went through there. And so unfortunately, when you come in to see us, there's kind of limited time to spend all sorts of time talking about all the different options. We do play a little video for you. We do try our very best to answer all your questions, but this just gives you maybe a little bit of a head start to be able to learn a little bit about what cataract surgery is and then some of the options and technology available. All right. So we're going to kind of learn a little bit about what cataracts are, talk about the cataract surgery, talk about options from the cataract surgery, and learn about things such as laser-assisted cataract surgery, and then learning about all the different lenses. So we call the lenses that we replace your old cataract with an IOL or intraocular lens. A lot of times you can think of this as, people sometimes wear contacts, but instead of having the contact on the outside of their eye, it's actually something that goes inside your eye to make it so your vision can improve. And then we'll talk about the risks and benefits of the surgery. All right, so we have a couple of videos that I'm going to play. So this is our first one. This just talks about what cataracts are. And I'll play that for you.
Cataract surgery is one of the most common medical procedures, and you have a choice in how it is performed, traditionally or via laser. In both traditional and laser cataract surgery, your surgeon removes the eye's cloudy lens and replaces it with a new intraocular lens, IOL for short. The main difference between the two methods is that traditionally, the surgeon makes the incisions and uses ultrasonic energy to break up the lens. By comparison, with laser cataract surgery, the surgeon first takes a 3D image of your eye to determine the precise location, depth, and length of the cataract. Using this information, the computer-controlled laser makes incisions and breaks up the lens into pieces. With both traditional and laser cataract surgery, the smaller pieces of the cataract are then removed from the eye using ultrasound and suction. Finally, the IOL is implanted into the capsular bag where the cataract used to be. Incisions in both procedures are usually so small that they do not require sutures. Both traditional and laser cataract surgery can help you achieve markedly improved vision. Depending on your eye health, vision needs, and IOL choice, one option might be better than the other. Talk to us today about which one is best for you.
All right, so let me get back to our presentation. So that just talks a little bit about what a cataract is. You can see in this picture, this is actually a pretty significant cataract. They usually, hopefully, they don't get to be this bad, where you can see right there in the middle of the pupil that kind of whitish tan looking discoloration. So usually it's not quite to that level, but sometimes we do see them that get to this level, and we want to make sure that we can take care of that to help you to see a little bit better. One thing that wasn't mentioned in the video is when we do the laser, we typically are also treating your astigmatism or kind of lower levels of astigmatism. We'll talk about what astigmatism is later, but that's one of the advantages of the laser as well. So intraocular lenses, like I said, are kind of similar to contacts or glasses. And so we have options of kind of single vision, that's either distance or near, or you can sometimes have lenses that are similar to like a bifocal or progressive lenses. So we'll talk a little bit about that. So when you come in to see us, we do a consultation. We'll do some measurements on your eye. We'll measure the length of your eye to try and determine what lens should go in your eye. We'll take a look at you, and then we'll talk at the cataract and make sure everything's safe and there's no other issues such as macular degeneration or glaucoma or other conditions that you might have. And then we'll talk about some of the options and some of the things that we will talk about tonight. So, coming into that consultation, it's important for you to kind of think a little bit, what are your goals? Some people, they like to wear glasses and they want to keep wearing glasses. Some people hate glasses and they'd like to throw them in the garbage forever. And so it's important for you to kind of know what that is. And I think the other thing is if you do want to wear glasses and you're doing kind of single vision correction, one of the biggest questions that sometimes people have is what do they want to target? So if you're doing single vision correction, that means that you might target distance vision to make it as clear as possible without glasses. And then up close, you would need reading glasses. Or the opposite. Sometimes people come to us and they already are a little bit nearsighted, which means they can read up close without glasses, but they wear their glasses for distance. And so in those cases, sometimes people will want to keep that. They might say, hey, I really like being able to take my glasses off to read, and then I'll put my glasses on for the distance. And so kind of knowing that in advance can be very helpful. Again, kind of, do you mind wearing glasses? Do you mind wearing them for up close, or do you hate glasses? And then the other thing is, are you willing to pay extra to try and decrease your dependence on glasses? And then do you drive at night? That kind of goes into some of the lens choices. And then have you had LASIK or other eye surgeries? That can we'll ask those questions, but letting us know is very helpful. And then kind of other issues, like I said earlier, we'll kind of make sure that you don't. But if you have some as you come in, just let us know. But we usually can find most of these things when we do our exam. All right, so there are kind of 5 different options when you do cataract surgery. The first one is just kind of that standard, what's covered by the insurance. Again, that's a monofocal, either doing far vision or near vision, but does not correct astigmatism. The next one is a laser package. And so the difference here is not only are you getting the laser that we just showed in the video, but you're also getting low levels of astigmatism correction. And then the high astigmatism package, so that is getting what's called a toric lens, and we'll talk a little bit more about that. But astigmatism above a certain level can't be corrected with just the laser. So we generally do the laser plus that toric lens. And then the premium cataract surgery, these are what we call multifocals or extended depth of focus lenses that can help to decrease your need for glasses for distance and for up close. And then finally, a light adjustable lens. And again, we'll go into that a little bit later. All right, so let's talk a little bit more about that monofocal kind of basic, what's covered by the insurance. So again, covered by the insurance, it does improve your vision because your glasses have, or sorry, your cataract is gone, but generally people usually need glasses. It depends a little bit on your astigmatism. So if your astigmatism is moderate to high, you'll definitely need glasses for probably distance and for near. If you don't have very much astigmatism, a lot of times we can get you out of glasses for one of the two visions, but you definitely need glasses for the other vision. Okay. The laser one that we just talked about, so that is that first option for what's not covered by the insurance. And so the benefits of this is it's more precise. It makes those incisions, opens up the cataract, makes it easier to get it out. And then the recovery, because of that, is a little bit safer and a little bit quicker. Again, can correct those low-level astigmatism. And then glasses are usually needed for near and computer if you chose distance, or the opposite if you chose near. So some of the downsides is it's not covered by the insurance, and that's mainly it. Okay. All right, there we go. So I gave you a teaser, told you that we would talk about astigmatism. So this is a video that talks a little bit about the astigmatism. Just before we get into it, you can see this image that we have where people are driving at night and you see all these streaks coming off the lights. That's because the light that's going into your eye, instead of it getting focused directly as a perfect cone of light, it gets focused kind of as a stretched out line of light. And so you see the main image, but then you see kind of extra images or ghost images next to it, and that's caused by the astigmatism. Sometimes it's not that big of a deal, but sometimes it's a big deal, and it makes it so, you can see this car on the right, okay, but then if you're looking out to the left where you see a bunch of things together, a bunch of cars that are together, some that are behind each other, now all those lights start to come together, and it really makes it so it's difficult to see everything together. So that's what the astigmatism causes. So let me play this video for us. Okay.
The cornea is the clear front window of the eye and should be perfectly round, like the shape of a doorknob. Astigmatism means that the cornea is slightly oval in shape, like the back of a spoon. If the cornea has significant astigmatism, then details such as print or street signs will appear blurred without glasses. Eyeglasses optically correct this blur by compensating for the oval shape of the cornea. The more astigmatism one has, the blurrier the vision is without eyeglasses. Astigmatism correction can also be incorporated into the artificial lens that is implanted at the time of cataract surgery. This is called a toric lens implant, and it must be positioned in a specific orientation in order to neutralize the astigmatism from the cornea. The toric lens implant does not allow you to both read and see far away without eyeglasses. It may not necessarily correct all of your astigmatism either. However, compared to a conventional lens implant that does not correct astigmatism, the toric lens implant should improve how well you see without glasses, and any eyeglasses that you do require should be less strong.
Okay. So And that goes over the astigmatism. So the toric lens, like I said, so if you have astigmatism above a certain level, and that's why we're doing the measurements in the office when you come in. So one of the first things you do is called an IOL master. That's checking your astigmatism. It's checking how long your eye is, and we use that information to kind of tell how much astigmatism you have, and then the level that needs to be treated. So again, this corrects the astigmatism, gives you your best vision when you have astigmatism without glasses, and decreases the dependence on glasses for whichever distance you choose. Again, not covered by the insurance, and then the glasses would be needed for near vision, assuming you chose distance vision, to be able to see up close. All right, so let's talk about a multifocal lens. So far we've talked about a monofocal lens that's covered by the insurance that can be done without a laser but does not correct your astigmatism. The next thing we talked about was the laser that corrects the astigmatism, makes it so the quality of the vision is a little bit better and a little bit safer. And then the next thing we talked about was the toric lens that corrects the astigmatism. It still is what's called a monofocal lens, meaning it's either distance or near. But it should make it so that whatever you target is more crisp and clear. So this is a multifocal lens. So this is probably most similar to a bifocal or a trifocal or a progressive lens, in that through the same lens, you can see distance, near, and up close. So we'll play a video that talks a little bit about that. Let me just start that for us.
A special type of lens implant, called a multifocal, simultaneously provides both near and far focus, and can greatly reduce your dependence on reading glasses after cataract surgery. This is because part of the lens focuses in the distance, and part of the lens focuses up close. And indeed, the name multifocal means multiple focal points. The design is entirely different from bifocal eyeglasses, where you look through the top portion to see far away and the bottom area to see close up. The multifocal lens implant is engineered in a way to provide both a distance focus and a near focus at all times, and the brain naturally and automatically finds the correct focus. Conventional lens implants are called monofocal lenses because they cannot provide the ability to see both far away and close up without glasses. Both the conventional and multifocal lens implants are implanted through tiny incisions and are equally safe, and there are no differences in the surgery itself. Not everyone with a multifocal lens implant can read equally well without glasses, and there are several reasons for this individual variability. For example, the healthier the retina is and the less astigmatism one has, the better the reading ability will be. It is also easier to read without glasses if both eyes have a multifocal lens, although it can be placed in only one eye. While there is no guarantee that you will read as well without glasses as you desire, it should be much better with multifocal lenses than with conventional monofocal lens implants. The multifocal lens implant probably won't totally eliminate eyeglasses, because most people will still find it easier to read with glasses under certain conditions, such as prolonged reading, reading small print, or reading when the lighting is poor. However, multifocal lenses should provide the convenience of reading many things without having to put on glasses, such as your wristwatch, cell phone, price tags, menus, and magazines. This avoids the inconvenience of always having to wear reading glasses to view anything up close. Remember that when you do wear reading glasses, you should see equally well with a multifocal or a conventional lens implant. Although multifocal lens implants reduce your dependence on eyeglasses, there are some trade-offs besides the additional expense. The lens can create the appearance of halos or rings around lights at night. Fortunately, seeing halos is a distraction that doesn't obscure the focus, and most patients describe them as being minor. Halos won't be apparent during the daytime and will become much less noticeable over time as your brain gradually adapts to them. This is similar to the way in which your brain blocks out background traffic noise over time. A multifocal lens implant isn't right for everyone, and it won't work well if you have too much astigmatism or other problems involving the cornea, retina, or optic nerve. Remember that both multifocal and conventional monofocal artificial lenses will provide excellent vision with glasses following cataract surgery. The difference is in what you can see when you aren't wearing eyeglasses.
All right. Okay, so let's get into that a little bit. So again, minimal to no reliance on glasses to see far away. Mid-range and near does usually quite well. It's probably the closest to natural vision. You may need some glasses for up close, but for like really small stuff especially. And then the halos and the rings at night is kind of one of the biggest issues that sometimes people have. So if you're driving a lot at night, that can sometimes be an issue, and you may say, maybe this is not the right thing for me. The other thing is you do need to have a pretty normal eye. So you can't have glaucoma, you can't have macular degeneration. Your cornea needs to be normal. We can treat astigmatism with this because there's a combination toric with a multifocal that you can use. But mostly your eye needs to be pretty pristine to be able to tolerate this. And then you have to have a little bit of an easygoing personality, I would say. So people that are a little bit more type A, that are a little nitpicky, that are always going to be worried about the rings and the halos, they tend to be less likely to get used to them. Whereas people that are a little bit more easygoing tend to relax, and the halos that they see, they kind of just let them fade into the background, and they usually tolerate them a little bit better. So this is kind of what I was talking, and obviously not covered by the insurance. Okay, so this is just a small little picture of kind of that ring or halos that people sometimes see. So this is the lens that we typically use. This is called a panoptic lens, and it gives really good outcomes, and patients are generally pretty happy with it. And this is just kind of showing that we usually will show this in the office also. We have the same picture printed, just so that people can kind of understand what it's like to have a multifocal and what people would experience. And if you're used to it and you're okay with it, then that's totally fine. But if people don't want this, then it's important to kind of recognize that this is a potential side effect of that lens. There's also lenses that are called enhanced monofocals. And so these give you just a tiny little extra bit of near vision. So we typically will use this with our laser assisted cataract surgery. So kind of included with that laser. So that's one of the advantages of the laser option, is that you can often have this lens. It's called an enhanced, that gives you just a tiny bit of intermediate vision. So it's not a full multifocal lens, but it does give you a little bit of intermediate vision. So you can see like dashboard on your car, shelves on the grocery store as you're going by them, and the risk of the rings and all that stuff and the halos is not the same. Again, this is kind of the same idea where on the left we see the normal lens, in the middle also that vividity or the kind of enhanced lenses, and then on the right is that multifocal lens. All right. And so if I'm not a good candidate for a multifocal, but I don't want reading glasses, what are my options? So you can do monovision. So monovision is where one eye is for distance and one eye is for up close, and we can kind of talk about that in the office. I generally don't suggest doing that unless you've tried it before. So if you're thinking that this is what you may eventually want to do, you can try this. Go to your optometrist, maybe try it with contact lenses or something like that to see if you can tolerate one eye being near, one eye being far. Blended vision is something that we can do, and we're going to talk a little bit more about that with the next lens, which is called a light adjustable lens. And then there we go. So the light adjustable lens is kind of a newer lens that allows us to tailor that blended vision, and I'll talk a little bit more about that. Right, so we can get to the next slide. There we go. I just want to make sure we didn't skip anything. Nope, that's it. Okay. So again, kind of knowing your goals can be very helpful as far as what you want to get out of it. So distance vision gives you just distance, near vision gives you just near. Blended vision generally will give you distance and a little bit of intermediate vision, and then a multifocal kind of gives you all three ranges of vision. All right, so let's talk about the light adjustable lens. So this is a pretty fantastic lens that is kind of crazy that this technology exists. But basically, it's a regular lens that's put in your eye, and then after the lens and the surgery is done, the lens can be modified and changed with a special light delivery device that changes the shape of the lens and makes it so that it treats the astigmatism, treats any disparity as far as the final visual outcome, and can be very helpful to help people to see really well. There's a video that I'm going to play on this one, and then we'll talk a little bit more. There we go. Okay, I'll get that started.
In the past, changing your intraocular lens, or IOL, after cataract surgery meant having another surgery. Light adjustable lenses are an IOL option that allows your doctor to adjust and improve your vision without requiring another surgery. Light adjustable lenses are similar to single focus IOLs, meaning that the lens will give you clear vision without glasses at distance or near, but not both. However, unlike basic single focus IOLs, light adjustable lenses contain photosensitive molecules that can be adjusted with certain wavelengths of UV light. Just like a tailor can alter your clothing to fit you best, your doctor can precisely adjust your IOL after surgery and fine-tune your vision. This precision is especially helpful to correct astigmatism, or if you've previously had LASIK. You can also try setting each of your two IOLs for different focal lengths to achieve clear near vision in one eye and intermediate or far vision in the other eye. However, if you try this and find the difference between eyes is too much, you can readjust your vision and change the IOLs back. Depending on how you set your light adjustable lenses, you still might need glasses for some activities, like reading fine print in dim lighting. In general, light adjustable lenses allow you to enjoy more freedom from glasses without experiencing halos around lights at night. After cataract surgery, you will return to your doctor for vision testing and 3 to 4 painless UV light adjustments spaced several days apart. During this time, you can try out and optimize your vision by adjusting the focal points for each eye at different lengths. After surgery, you are required to wear UV protective glasses all day long, both indoors and outdoors, so your new lenses don't accidentally change. After your final treatment, your lens prescription can no longer change, and you won't need to wear the UV protective glasses. Light adjustable lenses give you more precise control over your vision after cataract surgery. Depending on your priorities, this may be an excellent IOL strategy for you. So talk to us today.
All right, so that is the light adjustable lens. So it's probably been, it's been FDA approved for quite some time actually, but we've had it since probably 2021. So, about 5 years or so. So it's been a great addition to our practice to help people that are a little bit more discerning, that want something a little bit more precise. We generally will do one eye for distance and one eye for up close with that blended vision approach that we talked about before, to allow people to decrease their dependence on glasses for distance and for near. As the video kind of talked about, there's kind of those pros as far as making it very precise and decreasing the need for glasses without the glare and halos. Downside is obviously that's not covered by the insurance, that there's some extra visits, as it talked about, and then also those sunglasses that you wear until you're done with all the treatments. This is just an example of the machinery used to treat the lens. And this is kind of how we treat the lens to change the shape of it. All right, so this again, it's kind of the same thing as what we said. It's much more likely to get you that spectacle independence. You can preview your vision and kind of see if you like it and adjust it as we need to. And then anywhere from 2 to 4 treatments. And then the glasses, kind of like we talked about. Okay, so that's the light adjustable lens and kind of what's involved with that. It's particularly useful for patients that have had LASIK. So if you've had LASIK, unfortunately, it changes the shape of your eye and it makes it so that the standard lenses or toric lenses or any other lens that we use is a little less predictable. And so this kind of increases the predictability of that and makes it so it's much more likely to hit our target to where you desire. All right, so here, just this is something that we'll give you in the office that goes over all the different packages. Option number 1 is not on this paper, which is the one that's covered by the insurance that we talked about first. And then these are just the ones that are not covered by the insurance that include laser. So the first one is just the monofocal with the laser. Second one is the a monofocal toric. So some people need the toric, some people don't. And we'll let you know about that. The next one is that multifocal lens. And then the third one is that light adjustable lens. And then all these things, when we do the surgery, there's also a drop that we use that combines the 3 medications that we typically use after cataract surgery all into one. And so this is something that's kind of included with these packages. All right, so the main thing is kind of deciding what's most important to you. Do you want to or not want to wear glasses? And so that's kind of first thing. Second thing is, when do you want to wear glasses, for distance or for far? Do you want to be able to, are you willing to kind of pay above what the insurance pays to try and get some of these more individualized lenses? And then the rings and the halos. So if you're thinking about a multifocal, you have to decide whether or not you're okay with those rings and halos that we showed in that video. Last thing that we talk about is just kind of risks of cataract surgery. Fortunately, the risks are quite low with cataract surgery. It's the most common surgery done in the United States. And people, it used to be, well before my time, when people had cataract surgery, they would be admitted to the hospital. They'd have these sandbags next to their head to make sure they didn't move, and they'd have to stay in that same position for like a week. Now you go home, you can kind of go back to your normal life pretty quickly. Usually 24 hours later, the anesthesia is gone. And then we'll see you and kind of let you know what your vision's doing as far as driving and all that kind of stuff. But typically we'll say no heavy lifting or bending for about a week after the surgery. But a lot of the other things you can kind of get back to pretty normal activities. But yeah, there are risks. And so that's why we want to make sure that you need the surgery. So sometimes people will show up and their vision's very good and they don't really need surgery yet. So we'll say, hey, it's probably too early. But people that need surgery or they're having symptoms, I think that the risks, like I said, are pretty low, and so the benefit is usually outweighs those very small risks. So the day of surgery, so you come in, and if I can get to there we go. So don't eat and drink anything after midnight, the day of the surgery. So very important. A lot of times we have patients that forget. They come in and then they, eat a big breakfast, and unfortunately we have to cancel the surgery. And for the most part, we are booked out a good amount of distance or time. So it's usually a minimum of 2 to 3 months. And so then if you already waited 2 or 3 months, now you might be waiting another 2 or 3 months. And so very, very important to pay attention to this and make sure you're not eating anything like we will tell you. Okay. It is twilight anesthesia, so you're not completely asleep, but you are kind of relaxed. And that makes it a lot safer than doing general anesthesia, and it makes it so your recovery is a lot faster. You do need to have a driver, so you can't have somebody drop you off or take an Uber or whatever. So you do need to have a responsible adult take you home. You'll have a clear shield when you're sleeping at night, but when I do surgery, I just send people home without that shield on, but they just put it on when they're sleeping at night. And then you can start on those eye drops when you go home. You'll have a little bit of discomfort, irritation, foreign body sensation, kind of burning for usually the first 24 hours. Most of the time when people come in the next day, they say, hey, last night was a little bit scratchy, irritated, but about an hour or two ago after I woke up, it was feeling pretty good. And the vision will be a little bit blurry. You might see some halos initially because your pupil's really widely dilated. So don't be alarmed by that. I've definitely had people 5 minutes after surgery say, "Why can't I see perfectly yet?" And I have to let them know it's going to take a little bit of time for it to heal up. You just literally had surgery 5 minutes ago. All right. So yeah, like I said, kind of get back to normal life pretty quick. Usually the eye drops last about 4 weeks. And generally, if you need glasses, that's usually happening in about 3 to 4 weeks after the surgery. And then the second eye is usually anywhere from as quick as a week, and as long as you need. Like if you just need one surgery and the other surgery, you don't need it for years. Sometimes it can be years. But typically, if we're doing them back to back, it's usually anywhere from a week to a month in between eyes. So in summary, cataract surgery is a safe procedure with very low risks. It's a once in a lifetime opportunity, so it's important to have the information that you've gained tonight. And then kind of think about how you want to invest in that and how you want to see and what you want to do after your surgery is done. And we're always happy to help you and work through things. We have really good staff that are able to call and answer your questions. Specifically, our surgery coordinators know about these lenses, and so we'll set up times to have you talk to them and make sure you're getting the things that you want. So now there is time for questions. So I'm going to escape out of this, stop sharing. And so if you do have questions, you can type them into the chat. And I will try and pull that up. Let's see here. Yeah. So if you know how to answer type into the chat, you can ask questions in the chat. If you have any burning questions that we didn't go over that maybe was a little bit more specific to you, I'll kind of maybe go over some of the common questions that people have about their cataract surgery that we didn't already go over. So one of the things is, if somebody has that pre-existing condition, what can they expect or what are their options? So if you have macular degeneration or glaucoma or those types of things, really most things are available to you except for a multifocal lens. So the multifocal lens will kind of cause you to have some decrease in the quality of the vision a little bit. And so if you have another condition that also decreases the quality of your vision, then we really can't add that multifocal lens in there. And so that's kind of what's involved with that. Okay. Let me answer some of these questions. Would I be able to fly 4 days after surgery? So typically what we want to see is we typically will say it's best to stay in around for about a week after the surgery. So typically, again, very uncommon for this to happen. It's about a 1 in 10,000 chance that you get an infection after surgery. But the infections typically happen about a week after the surgery. So 7 days, give or take. So that's why we typically want you to be around. As far as physically flying, again, not that big of a deal. As far as we don't want you to heavy lift, bend and lift up the luggage as far as that sort of thing. So that's 4 days is a little bit cutting it close, but if you talk to your surgeon and see what they say as far as doing that. Can you do both eyes at the same time? So we generally do not do both eyes at the same time. So the insurance doesn't usually pay for the 2 eyes. In addition to that, we want to make sure that one eye has recovered and it's doing well and there's no infection before we move on to the other eye. If you are set for distance, will you still experience halos? So if you have a standard cataract surgery, if you have anything that's not a multifocal, then you're likely to not have halos. But if you do a multifocal lens, we're always targeting a multifocal for distance, in that we're doing distance, but it naturally will give you the full range of vision. And so it's really just with the multifocal that people have those halos. Could you please speak about the newer lenses, Pure Z? I don't know what if that's spelled right. I'm not sure what a Purzi is. I understand they have been available in Europe for a number of years and introduced into the US this year. So I'm unfortunately not familiar with the Pure Z lens. And again, I'm not sure if that's spelled right. There are a lot of different multifocal lenses, and yeah. So sorry, I wish I could answer that question. I'll have to look that up. But Pure Z doesn't ring a bell to me. I'll have to look that up. But yeah, bring it up with your surgeon. And so there are some lenses that were in Europe that we've gotten, but they do tend to get things earlier than we do. But the trifocal lens that we generally use has been a good one that was in Europe for a long time before we got it. How long does the surgery take, and how long will I be at the surgery center? So the surgery generally takes, once we get started, probably about 10 to 15 minutes, but you're going to be there longer. I would kind of anticipate 2 to 3 hours, just because it takes a little while to do the paperwork, get your eyes dilated, get the IV, and then do the surgery, obviously, and then to recover for a little bit. Do you use Vivient lens? So I'm guessing that's a Vivity lens, maybe. So the Vivity lens is a decent lens. I would say that in my experience, so what the Vivity lens does, I'm guessing that's what you meant, but what the Vivity lens does is it gives you a little bit of extra range of vision. So it gives you distance and gives you intermediate. It does not give you near vision. It's designed to try and give you less rings and halos. In my experience, I feel like it still gives some degradation in the quality of the vision, and it doesn't give you as much range as one would want. So I personally feel like using an eye-enhanced lens that we talked about earlier is a better lens, gives you just about as much intermediate vision as the the Vivity lens does. Again, doesn't give you the near vision, but it doesn't have the same side effects, and the cost is quite a bit cheaper. And so I tend to do that instead of the Vivity lens, just because I haven't been as impressed with the quality of it. And honestly, the multifocals now compared to older multifocals tend to do better. And so we have less glare and halos and better quality of vision. So that's my personal feelings, but there's other doctors that might feel differently. So the next one is, do you use the latest laser machine? Yeah, I mean, so our laser I think is about a month old. And so it's kind of a newer iteration of what we were using before. So it has some extra capabilities. But yeah, so latest laser, yes. I only have cataract in my right eye. How does that affect my options? I wouldn't say it necessarily affects your options. You can still have cataract surgery. It does make it a little bit tricky when we're doing maybe like a light adjustable lens. So if you said, hey, I want to do a light adjustable lens and I want to do that blended vision, we can still kind of make it work, but you're not going to have the full benefit of it until you have both eyes done. But other than that, most options are pretty similar. Can you confirm the time of the first consultation? I was told it would be a 3-hour office visit. So sometimes it can be. So it just depends on how things are going. It does take probably almost an hour to do the testing. So you come in, hopefully we've done your paperwork before you come into the office. But then we have to do the testing, we have to dilate. The dilation alone takes about a half an hour, and then we're talking to you for probably 20 minutes or so. And then sometimes, depending on the doctor, sometimes you'll also talk to the surgery coordinator. So I would say plan for 3 hours for the consultation, and if it's less than that, you'll be pleasantly surprised. Okay, my right eye had an epiretinal membrane surgery in the beginning of last year, and then now I have to have cataract surgery. So is it possible for my left eye will have an epiretinal membrane surgery too? Yeah, so it just depends on if you develop an epiretinal membrane. So that would probably be a better question for your retina surgeon. Um, and should I have both cataract surgeries done this year? You can, yeah. I mean, so if you have to, or you think you need to have an epiretinal membrane surgery on the other eye, as you've experienced, the surgery they did probably hastened their formation of your cataract. And so sometimes it's better just to have both eyes done so that if they do need to do surgery on your other eye, then it's not going to cause a cataract because you already had cataract surgery. All right. So how long have these lenses been in use? So all the lenses are, I mean, the nice thing is there's a lot of new things coming as far as lenses are concerned, but like light adjustable lenses have probably been around for at least 10 to 15 years as far as the studies are concerned. They started to gain popularity before COVID, but also obviously because of the frequent visits, it wasn't as popular during COVID, and then it became more popular after COVID once people were okay being in the office and stuff like that. So that's been around for that long a time. I would say the panoptic trifocal lens. We just got a newer version of that that's called the Pro that's a little bit better, and that's been probably a little less than a year. So a lot of the lenses have been around for a long time, like the monofocals have been around for eons, but the multifocals and the newer lenses, there's always something new, just like everything that's happening in life. Do I stop taking Eliquis? No, you do not need to stop any blood thinners. Will night driving be better with less stars coming at me? Yes, depending on if you choose what you choose. But yeah, it should be better. The next question is SLT. So SLT is a laser that's done for glaucoma. It's not done for cataract surgery, and it's done in the office, so it's a very separate thing. So I'm not sure exactly what that's referring to, but it's again not the same thing, not done at the same time. I was diagnosed with a posterior polymorphous dystrophy on my left cornea and need cataract surgery. Is it safe to have cataract surgery with this diagnosis? I have slight cataract in my right eye. Your thoughts? Yes, so it's safe to do cataract surgery. It may make it so that your outcome is a little bit slightly different as far as the outcome, and you might need glasses, but probably something specifically to talk to your doctor about based off of your specific amount of an issue. Is there an upper age limit for cataract surgery? Nope. I've done cataract surgery in people that are in their hundreds. So, um, I'm searching for the premium multifocal lens as a golfer. When I address the ball, I need to see the ball 5 feet away, then immediately need to focus 100 to 200 yards away. Will these lenses work for that? Yeah, so a multifocal lens will help you with that for sure. You'll have all the different ranges of vision, but honestly, distance usually starts about 3 feet away from where you are, 3 to 4 feet ish. So the ball at your feet should be technically distance vision. And then as soon as you strike it, obviously it's going to be farther away. So you're mostly using your distance vision for golfing, unless you're like looking at the golf ball trying to read it to make sure that it's your golf ball or things like that. So that's mostly a distance activity. Can you explain a little bit more about the enhanced monofocal lens? So it's called an eye-enhanced lens. There's some other ones that are also sometimes used. So it gives you a little extra range of vision. So typically what will happen is when we use our eyes, our distance vision, like I said before, starts about 4 to 5 feet from our eyes. And that's distance. And then intermediate is kind of in the middle where it's computer, that distance. And then near is kind of when you hold something to read. So the enhanced monofocal gives you a little extra range of vision. So instead of starting the vision at that 4 to 5 foot range, it probably is starting maybe like 3 to 4 foot range. So that allows you to see things that are a little bit bigger print as far as reading. But also allows true computer distances and allows you to see dashboard on your car, that sort of thing. Can you talk about what it's like in the operating room for the surgery? So when you have the surgery, again, you'll be laying on a bed. They'll roll you in. A lot of times you'll get some sedation before you even go into the operating room. And then that will kind of keep you relaxed. We put kind of a clear drape that keeps things clean so that it's just opened only where your eye is. And then we put a little eyelid spread on your eye to keep it open. So you don't have to worry about blinking and holding your eye open because we have something that helps to do that. The anesthesiologist is right there. So if you're feeling nervous or you're feeling uneasy, we just kind of let us know, and then we'll have the anesthesiologist give you a little bit more to make sure you're comfortable. You look at a bright light during the surgery because that's our microscope. Usually you don't feel a lot of anything. You might feel a little bit of pressure. You might feel some stinging here and there when we give you some sedation medications, or sorry, some anesthesia topical medications. Just the same way in the office when we give you a topical drop, it sometimes stings for a couple seconds. Same idea. And then the surgery, again, you're just kind of laying there for that 10 to 15 minutes. And then afterwards, we take all the drapes off. That's sometimes the worst part because it's kind of sticky, kind of like pulling a Band-Aid off. And then that's about it. And then you go back out to the recovery area and then you recover there for about 10, 15 minutes or less sometimes. And then you head on home. So that's kind of what's involved with that. So great. Well, it's great to have you guys all join us, and hopefully we're able to answer all of your questions. I hope you have a good evening, and I hope that when you come in to see us, we're able to fully answer your questions specifically to you. So I think you'll all do great, and we're excited to see you in the office. All right, take care. I'm one of the